not only an interesting topic, but a fascinating time in our nation's history to be involved in answering these questions and being part of this discussion. We've already touched on so much of this. I just want to kind of step back for a second and say that, you know, the fate of the ACA has been in question since 2010. It has faced a number of challenges, not the least of which was a Supreme Court decision already, a presidential election already, state implementation or not already. We have another Supreme Court decision coming up at the end of June. If you had asked me last year, and you actually did ask me last year, if I thought this measure would actually make it to the Supreme Court, or this case would actually make it to the Supreme Court, my answer was no. They surprised us. And they took up this issue of, it's King v. Burwell is the case, and the question at hand is, does the law allow these subsidies to actually flow through the federally facilitated marketplace, the FFM, or does the law only allow them to flow through the state-based marketplaces, the SBMs? And the way the law is written, it's actually very clear. It only mentions, it doesn't prohibit them from running through the FFM, but it only authorizes them to run through the state-based marketplaces. So we're not somewhere where we haven't been before, but I will say this, the next 18 months will be, we'll get a lot of questions answered, but given what Mr. Albertoni just said, this 18 to 24 month planning window that we have for 1332 becomes even more critical, because one of two things will happen. Either the ACA will stand and states will be exercising their options under a 1332, or the ACA will go and some other plan will replace it. And either way, states will have options to innovate in a way that they have not before.